Hi, welcome to Cascades MedSpa. My name is Rick McCoy. Today we'll be demonstrating the THERMAGE CPT Cool Pulse Touch Lower Face THERMAGE treatment. This is one of my favorite treatments. We've seen excellent results over the years, and THERMAGE has updated the treatment to even better heating depths and also has made it completely safe for the patient. As a technician, I like to do prior topical numbing for the patient to make it a little more comfortable. The newer CPT machines have technology that allows us to measure the heat under the skin, so we're not going to cause any of the past issues like facial atrophy or melting of the fat pads. We're simply going to warm up the dermal layer and make this a very comfortable treatment for the patient. Now, this patient's main concern was lower facial sagging. Since each THERMAGE tip is limited to the amount of pulses that is on it, we're going to spend those extra pulses on the lower part of the face and not using any on the forehead, since that's not really a concern for her. So as you can see, we went ahead and I already pre-prepped the patient and put grids on her. The grids are there so me as a technician can just follow the grids and give a really even treatment. Then the second part of the treatment is what we call the vector zones, and these are the zones that we go in and we treat where we need extra treatment. And as you can see, I've already drawn off the vector zones on the face with a skin marking pen that allows me just to go along and treat those extra areas. So first things first, I'm going to go ahead and apply some glycerin type fluid. It's called coupling fluid, but it allows the device to get a really good connection with the skin to perfectly read out the depth. So we're going to go ahead and start. I'm going to set her treatment level at about a 3.0 to give her optimal results. This is completely adjustable for patient tolerance. So if the patient cannot tolerate the 3.0 setting, we do want to go ahead and lower that for her, and we'll ask her along the treatment. So first things first, let's tune the handpiece. The tuning just goes ahead and tells the machine how deep we're going to go with the treatment. It uses MRI technology or electromagnetic energy to read out the depth of the skin. And now we're going to go ahead up to our treatment level, and we're going to adjust the vibration of the handpiece. The CPT handpiece has a vibrating handpiece tip. The tip actually vibrates in a heavy vibration to trick the brain into feeling vibration instead of heat, making it a more comfortable experience. So we're going to go ahead and start with what we call a super pass, where we're going to go over the grid 2 times, and the super pass, we're overlapping each pass to make sure we're heating accordingly. And here we go, starting the treatment. As I see, the patient is having a little difficulty with this setting, so I am going to go ahead and reduce the setting slightly, a 0.5, to see if that's a little bit better for her. Let's see. Okay, this seems to be a little bit better. The patient seems to be tolerating quite well. And then you also want to reassure the patient and ask them how they're doing. And is this treatment setting a little bit better for you? Okay, so she is doing pretty well. And again, you can adjust up and down. The face seems to be a little more comfortable during the treatment than when we reach the neck area. And at that point is when you really want to adjust your settings to give the patient total comfort. Alright, so now we're just finishing up the THERMAGE CPT lower face procedure. This is what we're calling the vector zones, and the patient did ask me a few minutes ago, what is a vector zone? A vector zone is also known as the problem zone, or areas that need extra attention with the THERMAGE treatment. So as we finish up, on her skin you'll notice there's just a little bit of redness. There's really no edema or swelling. It's just a little tiny bit of some redness, which typically fades away in about 20 minutes after the procedure. Also with the procedure, you can get some instant tightening, but it does typically take about 2 months to see the first results from your THERMAGE procedure. And those results continue improving for 6 months after the procedure, and you typically get about 2 years out of the results. We only have a few pulses left, and last pulse. Fantastic. Now that the patient is finished, we'll go ahead and clean her up, remove the stencils from her face, and then for the aftercare, we simply recommend using a good moisturizer or a sunscreen, or I see excellent results using a growth factor. And a growth factor is a product that helps to strengthen the skin, strengthen the dermal layer, and strengthen the collagen bands. Two of my favorite products would be the TNS Essential Serum or the TNS Recovery Complex, or also the Neocutis Biogel or BioCream. Those two products tend to work hand in hand with this procedure, and they would simply use this product throughout the THERMAGE results to continue results and even extend the results longer for them. Thank you for joining us today. We are located in Maitland, Florida, 15 minutes from downtown Orlando, and we offer complimentary consultations every single day, Monday through Friday. Feel free to give us a call, and thank you for joining us. Bye-bye.